We spend more on healthcare than any country in the world. We produce more food than we could ever consume. And yet, chronic disease rates keep climbing. Mental health is getting worse. And according to the US Surgeon General, about half of all American adults are experiencing loneliness. Something isn't working. The healthcare system is good at diagnosing what's wrong. It is not designed to address the conditions that drive poor health in the first place: food insecurity, social isolation, and chronic stress. These aren't symptoms, they're causes, and no prescription addresses them. These gaps don't fall equally. In South and Central Los Angeles, 1 in 4 residents faces food insecurity. The rate of preventable hospitalizations is the highest in the county. Low-income communities and communities of color carry the heaviest burden and receive the least support for the conditions underneath their diagnosis. That's where FEAST works. FEAST is a community health organization. We train community members as health educators, people who are already part of the communities they serve, to facilitate cohort-based programs that address food insecurity, chronic disease, and social isolation together. Each cohort meets weekly for 8 to 16 weeks. Health educators lead nutrition education and recipe demonstrations. Participants receive grocery support. But what makes FEAST work, what we call our special sauce, is the sharing circle. Every session, participants sit together in a circle and talk about their lives, about their relationship with food, about the challenges they face at home, in their bodies, in their communities. It is a safe space where people feel heard, often for the first time, and where they realize that the burden they've been carrying is not theirs to carry alone. This is where community is built, where mental and emotional well-being improves, and where people develop the confidence and support they need to sustain healthier habits. Because information alone has never been enough. People change when they feel connected, supported, and seen. The nutrition education, the food access, the grocery support, those matter. But without the sharing circles, they don't stick. That's the design, and that's what makes FEAST unique. We've built this model across 3 programs: for low-income adults facing food insecurity and chronic disease, for caregivers of young children 5 years and under, and for pregnant mothers. The same integrated approach adapted for different populations and different moments in a person's life. And now we want to go further. Other organizations want to bring this model to their communities. Some have, but fewer than half the organizations that we train as health educators through FEAST successfully launch and sustain a program. The gap isn't lack of motivation, it's infrastructure. Through a contract with the LA County Department of Health, 5 organizations are already receiving a free FEAST curriculum license and training their staff as health educators. The certification is happening in June. What we now need is the support to make sure these organizations can actually launch programs and succeed long-term. With LA2050, we're building that infrastructure: coaching, data tools, and hands-on implementation support that turns trained staff into a running program serving their community. This is how FEAST scales, not by growing bigger, but by building capacity at organizations already trusted in their communities, so that more people in Los Angeles have access to a community health model that actually works. One that improves mental and emotional well-being. One that reduces chronic disease. One that treats connection not as a bonus, but as the intervention itself. Join us and help us make this work possible.